Welcome to the 2021 Kentucky Employees Health Plan under age 65 open enrollment instructions for Teachers Retirement System retirees. The most popular question during open enrollment is, do I have to do anything? If I like my current coverage, do I need to do anything during open enrollment? So we've given you a little bit of guidance on this slide to let you know if you're not changing anything, if you're happy with your plan, that you don't have to do anything during open enrollment. So on the left-hand side of this slide, you don't have to do anything during open enrollment if you're not changing plans, you're not changing your level of coverage, you're not updating dependents, you're not updating your smoking status, or maybe you just thought you needed to go online and update your address or demographic information through the KHRIS system. But we don't want you to do that during open enrollment. We want you to send that directly to the Teachers Retirement System. But there are reasons that you would need to do something during open enrollment. So on the right-hand side of this slide, we're telling you, yes, you need to do something during open enrollment if you're changing plans, you need to change your level of coverage, you need to update your dependents, you need to update your smoking status, or you need to start or break a cross-reference plan. So as you'll note at the bottom of this slide, if you are starting or breaking a family cross-reference plan, you do have to complete a paper application, and you can find that on our website. You do have to complete a paper application to do that. That's not something that you can do online. So this hopefully slide gives you some guidance on letting you know if you do need to do anything during open enrollment or not. Keep in mind though, if you're happy with your insurance that you have in 2020, it will continue for 2021 if you don't do anything. So if you've decided that you do need to do something during open enrollment, let's go over the KEHP open enrollment process. So open enrollment is done through the internet with the exception of a paper application is needed when you do a family cross-reference, starting a family cross-reference or breaking a family cross-reference. You can't do that online. So you'll need to open an internet browser, and you can see here the options of internet browsers it's going to work best with. You're going to enter KHRIS.ky.gov, so that will take you into the KEHP Open Enrollment website. And once you've done that, this is the screen that you should get. Now, if you don't have your KHRIS user ID, you can click Forgot KHRIS User ID. That maybe is an ID that you received in the packet that you got from the Department of Employee Insurance. But if you don't have that, you can click on the Forgot the KHRIS User ID and go through that process to get your KHRIS User ID. Now, once you've gotten your KHRIS User ID, then you must select Forgot Reset Password to set your password on your account for this year. Even if you have your password from last year, it still must be reset, so be sure to reset it and go through that process. Previous year's passwords won't work because the KHRIS system makes you change your password every 30 days. So you're going to need to go through that process to reset your password. Now, once you have your KHRIS user ID and your password, then you will enter that information as you see here on this slide in the appropriate boxes, and then you are going to click Log In. Once you log in, you should see this next screen where you're going to see the User Security Agreement. So you're going to review this User Security Agreement and then click that you have read and understand this agreement. Then you're going to click on the Open Enrollment box to start the open enrollment process. Now keep in mind you see the abbreviated dates of October 12th through October 28th on this slide, but retirees have the entire month of October to do their open enrollment. But remember, you don't have to do anything for 2021 to continue with the same coverage you've had in 2020. Next, you should see the tobacco usage declaration. So you're going to review that tobacco use declaration. You're going to need to answer yes or no. And then you're going to click the save and continue that's on this screen. So you're going to see this pop up throughout your application. It should give you what you have noted on this section of the application, yes or no. And you'll see that throughout the application. Hopefully when you selected save and continue, it took you on to step 1, which is to review your personal information. So you're going to look at this slide. You're going to look at the display when you are in the application, and you're going to want to see, is everything correct? So if everything as far as your personal information is correct, all you need to do is click next. You can see that top arrow there showing you to click next because there's nothing to edit. So you don't have to edit the personal information if it's correct. But if you look at it and is everything correct? Well, no, it's not. So you're going to want to click on Edit Personal Profile to update your personal information, and that's the far right. What I'm expecting you to see at this point is the Edit Personal Data page. Now there are certain items on this page that you're not able to update, such as your name, your social security number, your gender. Those would have to be done through Teachers' Retirement System. But if you do have some information on here that you need to update, if you're going to change your plan and that's why you're in here and you need to update your address, you might as well do that. Make sure you update your email and your phone number if you need to, but to do that you'll have to click on that little pencil. Sometimes it's easy to miss. So if you've gone through there and you've updated your address, your phone number, or your email, those are the only things that allows you to update. So if you've updated those, then you definitely want to remember to click the save button before you move on. And you can see I've circled on the right hand side of this slide, it shows the tobacco usage, what you have designated there, yes or no. So it should display what you've already designated. And you're going to click next, so it will take you to the next section. So hopefully what you will see now is the dependents section of this application, step 2. Now it should list your dependents there. Note, now you might see dependents on there that have aged out and are no longer covered, but that's okay. They remain shown but are not covered if you've removed them in the past or they're no longer eligible due to their age. Just make sure that when you're choosing a plan that you don't sign up for a couple plan and include someone that is 65 or over. If your spouse is on the KHRIS Medicare eligible health plan already, you don't need to do anything to keep that coverage or anything on this application for that person. So you would just enroll in a single plan for yourself. Now, if your list of dependents all looks good and you don't need to add anyone, then you can just click next. But you're going to have to choose the Edit Dependents button if you need to update your family members. And so when you do that, click that Edit Dependents button. Hopefully this next screen should display the screen in the middle of this slide that's outlined in green. And it's going to show your family members so that you can edit your existing dependents with the pencil that is over on the far right. I've circled that in yellow for you. Or if you need to add dependents, you're going to click the Add button that I have the red arrow pointing to. Adding dependents during this step is not going to add them to your health plan. So you must complete that during step 3 and then it will add them to your health plan. But remember, you must have a social security number and a date of birth for any dependents that you add to this health plan. Now, if you do add any new dependents during open enrollment, you're going to need to watch for a letter from Alight with directions on how to verify those newly added dependents for the dependent audit. And Alight is the company that you would receive that request from. When you click Next, hopefully it will take you to the step 3, which is where you choose your health plan. So down at the lower part of your screen, you should see the actions where you can enroll or waive your health plan. So you're going to click there where it says to enroll or waive. It's a little paper icon where I have a red arrow pointing to that. So hopefully it will take you to a drop-down box. Now you should see a list of options of plans available to you, and your 2020 coverage should show up in blue. Now in this example, it only gives the options of single or couple coverage, and that tells me that this person has listed their spouse as a dependent and therefore has the option of choosing a single or a couple plan. I'm guessing they haven't listed any dependent children, and that's why they don't have the choice of a Parent Plus or a family plan. Now you will pick a plan by clicking the round button next to your plan choice. So keep in mind, if you select a couple, Parent Plus, or family plan, you are going to want to check each box and select each dependent you want to cover in 2021 under Enroll Dependents there on your screen. If dependents that you added in step 2 and that you want on your 2021 plan aren't displayed here, you're going to want to go back to step 2 and add them there. Hopefully it took you through the adding of your dependents, so we want to make sure now that you did select a health plan or you're waiving your coverage. We want to make sure that you've added your dependents if you're not choosing single coverage, and so you're going to click Add, and that has you adding your health plan. Now remember, retirees aren't eligible to enroll in dental or vision offered through the Kentucky Employees Health Plan. After you clicked Add, it should bring up this Living Well Promise screen. Just to remind you that every plan holder must complete the Living Well Promise by July 1 each year to receive the discounted premium. Once you've read this and you are reminded of this, you're going to be able to click Continue to complete your 2021 enrollment. Step 4 is Review and Save. So your 2021 plan selection should show here, and you're going to want to review this. So if this is all correct, then you're going to click Save. Once you click Save, hopefully it takes you to your congratulations page. You've successfully enrolled in the 2021 plan year and your enrollment is complete. So what you want to do at this point is you're going to want to click on the Print Confirmation Statement. And so what that will do is it's going to open as a PDF document. It's going to allow you to either print or save that document by clicking one of the icons at the top of your screen that you see. Now, if you don't have the ability to print the confirmation or to save the PDF, you can always take a picture of it with your phone and keep that as your proof. Just a few reminders for open enrollment. No action is needed, even for waivers, unless you need to make a change for 2021 plan year. The open enrollment KHRIS system does go live October 1st, so you wouldn't need to wait until October 12th. If you need to begin or end a cross-reference, just remember you do have to complete a paper application. That's not something you can do online through KHRIS. Any address updates need to be sent to TRS in writing. Even if you've done this through the KHRIS system, you are still going to want to send that to TRS in writing so we will get that. If you do make changes during open enrollment, please try to keep some proof of your confirmation, whether that is in the form of printing it or taking a picture of your confirmation on your screen. If you are turning 65 in January or your birth date is the first day of February, you're not going to need to do anything during the KEHP open enrollment. You should receive a packet probably the 1st of November regarding turning 65. Just remember, retirees are not eligible for the Kentucky Employee Health Plan, dental, vision plans, or for the flexible spending accounts. And always remember to complete your Living Well promise each year by July 1. Here's the contact information if you do have any questions regarding the plans or open enrollment or KHRIS. You want to call the Department of Employee Insurance, what we call DEI, at their open enrollment hotline. The number's here on the screen. And I've given you the open enrollment hours for assistance. This is Eastern Time Zone. So you can see there that normal work hours between October 12th through the 16th, but in October 19th through 23rd, they actually do have some extended hours. They have Saturday hours on the 24th, and then the last week of October, you're looking at even further extended hours from 8 to 8. October 26th through the 28th. If you want to look at the benefit booklet or anything online, I've given you their web address there at the bottom. And as always, you can reach us at the toll-free number listed here. Our offices are currently not open to the public, but you can always reach us either by email or by phone between the hours of 8 and 5, Monday through Friday.